Dr. Couture from Conley and Coons Equine Hospital, and today I'm going to talk to you a little bit about how to manage a catheter at home. So we have a few items that you're going to be sent home with when your horse has a catheter in. First is a syringe for flush solution. Second is a bag of flush solution that your veterinarian will make up for you. These are injection caps that you'll replace at the end of the catheter that allow you to put medication into the horse. And then you'll also have whatever medication you're being sent home with.
Go.
This is the setup that the veterinarian will send your horse home with if he has a catheter for IV medications. First of all, the catheter's in the jugular vein. This is the extension set. And then at the end, there's an injection cap that you put the needle into in order to give medications. On the extension set, there's this roller clamp that allows you to close off the extension set or open it up for when you need to give medications. And we'll explain that when we flush the catheter. The catheter is secured with several sutures, and with the time at which your catheter needs to come out, these sutures will need to be cut before the catheter can be pulled. So when you first go to give your horse a medication in an IV catheter, you want to check and make sure the catheter is still in the vein and that the vein doesn't have any problems. So you can hold off the vein like this and watch it fill and make sure that the vein fills. This horse's vein isn't filling really well, but you can see that it is filling when I hold it off, and then let it go, and you can see that the distension goes away. In addition to checking for distension of the vein before you give medication, you want to make sure that there's no heat, pain, or swelling at the site of the catheter, and also that the catheter is sealed closely to the skin, and that there's no drainage or space between, and that the catheter is not coming out of the skin at all. If it is, you can try to feed the catheter back into the vein and re-secure the sites of the sutures, or call your veterinarian and they can help you with it. So when you go to give medications, you're going to give them in this injection port here. Depending on the frequency of your medications, you're going to want to change that injection cap every 1 to 2 days, more often if you're giving more frequent injections and less often if you're only giving injections once or twice a day. And so the injection cap will come in this package. And this is where you'll want to make sure the roller clamp is clamped so that when you take off the port, the extension set doesn't fill with air. Simply unscrew the injection cap, discard it, and screw the new one on. When you first go to give medications to your horse in the catheter, you want to ensure that the patency of the catheter is okay and that the catheter is still in the vein. In order to do that, you'll unroll the catheter, the extension set, put your flush in the end of the injection cap, push a little bit of fluid in, draw back, and you should see blood like this. That means that your catheter is still in the vein. You can flush the rest of that blood out. This extension set that is long like this holds about 6 milliliters of fluid, 6 cc's. So you'll want to, each time you flush, at least push 6 cc's through. And then you can roll your roller clamp back, take the flush out, and whatever medication they're going to give, you do the same thing for that. You don't need to pull back to make sure the catheter is still patent because you know that it is. Push your medication in. And then simply follow with your flush, ensuring that you flush enough each time to flush the extension set completely out, at least 6 to 10 mils. And make sure you flush between each medication because you don't want any medications to mix. Also, if your horse is going to have this catheter in for several days, you're going to need to ensure the patency of it by flushing it. And we like to do that at least every 4 to 6 hours to make sure that the catheter doesn't clot and you lose patency of the catheter and you won't have the ability to give medications. So there might be a few problems you can encounter when you're trying to manage a horse with an IV catheter. First is what we mentioned earlier, that if the catheter starts to come out of the skin, you may need to try to push it back in, and if that's not possible, you'll need to contact your veterinarian to either have them fix the existing catheter or replace the catheter. If you notice any heat, pain, swelling, or leakage around the catheter site, you should pull the catheter and contact your veterinarian because it could be the sign of an infection, and that may need to be treated appropriately. The other thing that could happen is between flushes, sometimes a clot can form at the end of the catheter, and so it can be difficult to flush. If that happens, you can apply significant pressure when you put your flush syringe on the injection cap to try to blow that clot off. And if you still, after applying good pressure, can't get it off, you'll have to contact your veterinarian and see if they can help you get that catheter patent again, or even need to replace the catheter if your horse needs continued medications. So when you're done with the catheter and the horse no longer needs any medications, you're going to have to take it out. And to do that, you'll remove each of these sutures separately, and then you'll need to hold off the vein with a dry 4x4 or something clean, a clean paper towel, to ensure that the horse doesn't bleed. So if you have any small, suture scissors are wonderful, or any small cuticle scissors or something like that, you can just slip them under the sutures and take these out like you would any other suture. Make sure your extension set is loosed off the horse. And then just pull the catheter and hold the vein off for several minutes just to make sure that the horse doesn't bleed.